So I am Edward, a Brit, founder of Allied World Healthcare and one of the winners of the Tokyo round. So yes, not Asian. Problem statement: 3 billion people on our planet cannot access healthcare. It's a fact. World Health Organization, World Bank report last year. However, a common assumption is that there's no ability to pay, that these people are charity cases, that they can afford nothing, they're just destitute. Whereas, where I'm living in Southeast Asia, income levels are rising significantly faster, 4, 8, 10% GDP growth year on year. On top of that though, and further still, digital is growing again faster than it is here. There's 2 phones per person in Cambodia, where we do a lot of our work, and Philippines, and the level of internet use in older populations is growing significantly more than it is in the West. So the opportunity for digital health, for business model transformation is huge, and the main reason I left the UK to found my organisation. Now, what we do, 2 minutes left, is we go to disconnected communities 3, 4, 5 hours away from the nearest pharmacy, from the nearest clinic, and we train what we call access managers. They're normal people, sometimes health workers, sometimes not, but they're trained by us, given a training course and a tablet, and they become a source of local health support, of health information, of access to medicines, of delivering medicines. So an extension of primary care, an extension of the pharmacy, an extension of the clinic. And yes, all driven by digital. So I'm going to go on to our apps next, but we build apps that access managers use to become health worker-like people where there's no healthcare. Oh, that's louder. And then to finance all of this, what's our business model? How do we do this? We effectively build ecosystems of private sector partners to fill the gaps in public sector delivery. So you can go to an access manager, get support, we'll connect you to a government clinic when it's available. That clinic has no medicines, there's no insurance, there's no diagnostics. So we actively work with big pharma companies, Novartis, Sandoz, big insurers, and we help them understand market need, so sharing insights and data from our platforms. We look to run market research campaigns and events to sort of position their access offering, and we ultimately look to buy and distribute their products, putting a margin on that, keeping us sustainable. So all of our apps, they're using Curis, which is really health data collection, information, event management, and connecting people to primary care, MediConnect, educating health workers, Pika, which is our marketplace, so an Amazon of medicines, insurance products, Dispergo, distributing the products the last mile, Idea, our data platform. And last slide, we only started in March 2018, year to build our apps. We've launched in 40 communities across the Philippines. We've got 20% month-on-month growth of our users. We've created over 200 jobs for access managers, 87% are women, so creating solid, stable, well-paying jobs in healthcare. No.
Hey, well done, fantastic.